If we experience a worldwide pandemic caused by a new virus, nearly everyone will be at risk of getting it because no one will have natural immunity. Vaccination is not a realistic option for the first wave of such a pandemic because a vaccine may not be available until 4 to 6 months after the virus has been identified. But if you or one of your family members becomes ill, there are some basic steps you can take to stop infection from spreading. Coughs and sneezes are the main way that illnesses like colds and flu are spread from person to person. This can happen when people who are infected don't cover their mouths when coughing or sneezing. Droplets containing the virus can move through the air and make contact with someone else's eyes, nose, or mouth. Droplets from an unprotected cough or sneeze can also make contact with surfaces like tables, desks, and other household items. The virus remains infectious on those surfaces for 72 hours or longer. When people touch them and then touch their eyes, noses, or mouths, they too can become infected. The virus can also be spread if an infected person coughs or sneezes into their hand and then touches an object around the home like a doorknob, a TV remote control, or a toy with that hand. The next person that touches the object may become infected. That's why it's so important to wash your hands often and to keep them away from your face if they haven't been washed. You should always wash your hands vigorously with soap and water for 20 seconds, covering all surfaces of your hands, including your thumbs and between your fingers. The preferred method for washing your hands is to use soap and water, but you can use an alcohol-based hand sanitizer when soap and water aren't available. You can help stop the spread of infection at home and in public places by using something called cough etiquette, which you should practice even if you're not sick. It's very simple. If you need to cough or sneeze, cover your mouth and nose with a tissue. Throw the tissue in a waste receptacle and then wash your hands. If you don't have a tissue, cover your mouth and nose with your upper sleeve, not your hands. Consider designating just one person as the primary caregiver so that the risk of exposure to infection is kept to a minimum. Place a bag or waste basket by the sick person's bed so that the tissues they use can be properly disposed of with the rest of your trash. Avoid touching used tissues and other waste when emptying waste baskets, and always wash your hands afterwards. It's also a good idea to keep the personal items of all family members separate. Avoid sharing pens, papers, clothes, towels, sheets, blankets, food, or eating utensils unless cleaned thoroughly between uses. Disinfect doorknobs, light switches, handles, computer keyboards, telephones, toys, and any other surfaces that are commonly touched around your home. To do this, clean surfaces with a commercial product that is both a detergent and a disinfectant, such as Lysol. The detergent cleans and the disinfectant kills germs. Convenient disinfecting wipes are also available. These products should be used when surfaces are not visibly dirty. When surfaces are visibly dirty, the best way to clean and disinfect them is to wash the surface with a general household cleaner. This can be either soap or detergent. After cleaning, rinse the surface with water and then apply a disinfectant. If a disinfectant isn't available, you can make a household bleach solution to use as a disinfectant. Just add 1 tablespoon of bleach to 1 quart of water. Or, for a larger supply, add 1/4 cup of bleach to 1 gallon of water. Be sure to clearly label the disinfectant container so you do not use disinfectant for cooking or drinking. Use a clean cloth to apply the disinfectant to surfaces and let it stand for 3 to 5 minutes before rinsing with clean water. Always wear disposable or reusable rubber gloves to protect your hands when working with bleach solutions, and also when in contact with or cleaning up body fluids. You will find disinfectant solutions, cleaning products, and disinfecting wipes at your local grocery store, drugstore, or discount store. Always follow the label instructions carefully when using these products. As we've mentioned often in this series, good hand hygiene is essential because it's one of the most effective ways to prevent the spread of infection. That's why it's so important to wash your hands often, and especially after contact with a sick family member. Wash vigorously with soap and water for 15 to 20 seconds, covering all surfaces, including your thumbs and between your fingers. When soap and water aren't available, you may use an alcohol-based hand sanitizer, but soap and water are always preferred, especially after cleaning up bodily fluids or in the case of diarrhea. You should wash soiled dishes and eating utensils either in a dishwasher or by hand with hot water and soap. There's no need to wash a sick family member's dishes separately. When doing laundry for a sick family member, gently gather the soiled clothing, bedding, and linens without creating a lot of motion. For example, don't shake the sheets when removing them from the bed. Wash everyone's clothes in a standard washing machine as you normally would. Use detergent and hot water. Wash your hands after handling soiled laundry items and also before removing clean laundry from the washer or dryer, especially if you've coughed or sneezed on your hands. Once you put these steps for basic infection control into practice, they'll soon become routine. Having good hand hygiene, practicing cough etiquette, and keeping surfaces clean and disinfected could protect you and your family from becoming ill, and may even save a life.